So when this happened the other night, a lot of people started wondering, could I, if I had to, do CPR? Well, we're going to get a refresher course if you've had a course before, or we're going to do some easy teaching, some basic teaching on CPR this morning. We've got Courtney Burt with the American Heart Association and Johnny Johnson with AHA. Both, thanks for coming in. I appreciate it very much.
Thank you for having us.
All right. I think the thing that we want to stress here is we're doing the basics.
Yes.
And when you do the basics, it's pretty simple.
It is, yes. What we're going to be doing today is called hands-only or bystander CPR.
Okay.
So this is for non-trained, medically trained, or non-certified individuals.
And it's for a certain age group as well.
Correct. This is going to be for a large child, teenager, about 120 pounds or greater. So like an adult or a large child or teenager.
All right, talk us through it.
Perfect. So if someone collapses and falls over, the first thing we're going to do is check and see if they're responsive. Just tap their shoulders and yell, "Are you okay?"
Are you okay? They're not.
No response. We're going to do a very quick assessment, literally seconds, to look down and see if their chest is rising or if there's any normal breathing patterns.
Okay.
There's not. So then we're going to call 911, or if there's someone there with you, shout out to them to get 911 on the way.
That's the first thing you do.
Very first thing, we want to get trained medical staff on the way to help us.
And keep it on a speaker.
Correct.
Okay.
So the 911 operators are trained on how to walk someone through this. So if you panic or you don't remember steps, they will actually help you through this process. Then we're going to just begin chest compressions, hard and fast in the center of the chest.
When we say center of the chest, I'm going to hold this up. If you
Yes, that'd be great.
You tell me it's just below the nipple line.
Correct. We want to be right here. That's a good reference point in the center of the chest, and have the heel of our hand in the lower part of the sternum.
Okay. And
then you're going to put your shoulders over the palms of your hands.
Yeah.
The big thing, and it doesn't matter which hand you put first, you just want to have your fingers off the chest to get a good compression. Have your shoulders over your palms and push hard and fast. We want to get a tempo of about 100 to 120 beats per minute.
Okay, is this the music Staying Alive? Is this where this comes from?
Staying Alive, Baby Shark. There is a whole playlist actually if you go on that American Heart has put together with different CPR tempos.
All right, so here we are. We're doing this. We're waiting for the experts to arrive. This is work.
It is. It is. If there's another person present in the room, what you would want to do is, if you start to get fatigued, communicate to them,
right,
and they can come to the other side of the chest and take over.
I want to say something, because we're hearing this clicking, because this, for demonstration purposes, this is how you know you're doing it right.
It can help you make sure you're getting that correct tempo, yes.
But also, you're doing it deep.
Yes, you have to get about a 2-inch on an adult. You want to get 2 inches down, do a full compression, and then allow the chest to rise back up. What we're doing is we're acting, the person's heart has completely stopped pumping.
Right.
So we are trying to get that oxygenated blood out to vital organs like the brain, all of our other organs. So we want to be that pump.
So I'm not necessarily getting this person's heart to start beating again, am I?
You're not trying to, spontaneous resuscitation might happen, but it's unlikely. You are just acting and being the heart in this time.
And again, what we're telling you guys this morning, this is the most basic moves.
Yes.
You can do advanced, you can learn advanced.
Correct. You can become certified. There are different things. If you go to heart.org/CPR, there are classes that teach different levels of life-saving skills, or you can go on and literally in 2 minutes learn how to do this by watching videos.
And for those of us who learned this in the past, there's no blowing in the mouth anymore, holding the nose. That's you don't encourage that anymore.
For this type of layperson training, we don't do the rescue breaths. Oftentimes, if it's too complicated, people won't do it. So any CPR is going to be better than no CPR, and oftentimes it takes a few minutes for help to arrive.
Right.
And in that few minutes, there's enough oxygen. We don't need to do the rescue breaths. We just need to get that oxygenated blood circulating.
I think you just said it. You said it. I want to say it again. Any CPR is better than no CPR.
Exactly. Just do your best. You are attempting to save someone's life, and you just do your best. If you get fatigued or if you're panicking that you're not doing something right, their heart has fully stopped beating. Anything is going to be better than nothing. We know for sure if we do nothing that they will die.
All right. Thank you. Thank you both very much. It's very nice to see you. If you want to learn CPR for yourself, there are courses all around Tampa Bay. Just go to heart.org and you can learn the hands-only CPR. And it's a little 2 minutes, as she said, by watching a video that the American Heart Association has online. Thank you so much for coming in. I needed to hear all this again.
Awesome.
Appreciate it.